His tone was dripping with disdain, loud enough for everyone in the room, including the patient, to hear. Angela froze for a split second, her cheeks burning, but forced herself to remain calm. She quietly checked the monitor to ensure she hadn't missed anything, though she already knew she hadn't. The humiliation didn't stop there. Harris stepped closer, towering over her, his words growing sharper with every breath. Honestly, I don't know why they continue to keep you here. You're slow, you're careless, and let's be honest, you'll never rise above being a nurse. He deliberately lowered his voice at that last remark, but the sting of his words carried louder than any shout. The other staff members standing nearby shifted uncomfortably, their eyes darting between Angela and the patient, too afraid to intervene. Angela swallowed hard, forcing herself to keep working. Every instinct inside her screamed to defend herself, but she knew Harris's reputation. He was untouchable, shielded by years of seniority and the hospital's politics. To argue back would only give him more ammunition. So, she pressed her lips together and focused on adjusting the IV line, her silence becoming both her shield and her punishment. Still, the weight of his words pressed against her chest, making every movement feel heavier than it should. All the while, the old man on the bed remained perfectly still, his eyes never leaving the scene. His gaze was steady, unwavering, as if he were studying every detail of this cruel exchange. There was no anger in his expression, no sympathy either, just a strange, calculating calmness. It was as if he had seen such injustice before and was waiting, biding his time, to reveal something no one in the room could possibly expect. As Dr. Harris's cutting words lingered in the air, the room fell into a heavy silence. The fluorescent lights flickered above, humming softly, while the only other sound was the steady beeping of the heart monitor. Most patients in that situation would have looked away in discomfort or spoken up to defend the nurse. But the frail old man lying on the bed did neither. His thin lips curled slightly, almost into a faint smile, as if the humiliation unfolding before him was nothing more than an act in a play he had seen many times before. Angela couldn't help but notice the way his eyes followed her. They weren't the tired, distracted eyes of an ordinary patient. Instead, they were piercing, sharp and aware, with a strange glimmer that unsettled her. It felt as though every movement she made, every breath she took, was being weighed and measured by him. Despite the shame she felt under Dr. Harris's attack, Angela sensed something in the patient's expression that kept her steady, as though he were silently telling her not to break. Dr. Harris, however, remained oblivious. He scribbled angrily onto the patient's chart, muttering insults about incompetence and lack of discipline, all while the patient lay motionless, observing. The old man's calmness was unnatural. It wasn't the kind of passive quiet born from fear or weakness. No, his silence carried weight, authority even. As if he knew that time would reveal truths the arrogant